I'm Cherie Miner. I'm a non-surgical sports medicine physician, and I work at Andrews Sports Medicine and Orthopaedic Center. I grew up in upstate New York in a small community. I grew up essentially on a farm, so I was very active outdoors. High school, I did play field hockey, basketball, and softball. I went on to play college sports at Boston University. I played field hockey and softball. My major was actually in health sciences and pre-physical therapy. I eventually came to know that I wanted to be a physician, so went on to medical school at the University of Massachusetts and initially specialized in pediatrics. And through there, did a fellowship at Penn State and got acquainted with a non-surgical sports medicine physician, and then decided to go on and do my fellowship in that area. So I came to Birmingham and did my sports medicine fellowship with Dr. Andrews. Working with Dr. Andrews through ASMI was fantastic as far as getting great education. I think having trained in pediatrics really helps me to be able to work with these kids, make them feel comfortable, make them feel confident that they're going to get better, and then helping them be confident when they're back on the field, doing more than just fixing their broken arm or their torn ACL, because kids will be apprehensive when they first try to get back. And working at Andrews Sports Medicine with so many other physicians here with such a wide range of experience, if there's something that you may struggle with and not know it wasn't your expertise, you have so many physicians that you can go and talk to and work with and refer your patients on. So it's just a fantastic place to work as a non-surgical orthopedic. So we treat generally joint, muscle, tendon, bone injuries. So in a daily routine patient injury would be a broken arm, torn ACL, the knee injury, rotator cuff tendonitis, ankle sprains, really anything you can think of that has to do with bones, muscles, or tendons. We'll also see lots of patients with arthritis. We do lots of cortisone injections for joints. We do platelet-rich plasma injections, stem cell injections, sort of other alternative approaches that we can use to get patients back on track if the standard methods are not working. Our main office for Andrews Sports Medicine is downtown at St. Vincent's Hospital and the Ortho Sports Center. We also have satellite clinics, and on Wednesdays I'm at a satellite clinic in Greystone. For 5 or 6 years now, I've been doing Ironman triathlons, usually one a year. I'm at the half Ironman distance, hopefully to get up to the full Ironman distance. And doing these and being around the runners and the triathletes has really pushed me to understand more about those type of injuries that occur more with overuse than those that you see maybe on the football field with an acute injury. I cover several schools. We have Trussville, Mortimer Jordan, Pinson, St. Clair, Springville, Aniana, and the remainder of Blount County we are also taken care of. Pleasant Grove, so we'll essentially rotate from school to school. I usually get 3 games per school a season. If I was not in sports medicine, I would be a veterinarian. My other love is animals. They're almost like children to me. They're innocent. Someone needs to take care of them, and I just have a big heart for animals. So I would be a veterinarian, and probably would be doing a similar thing. I'd probably be an orthopedic veterinarian. My passion in sports medicine really comes from just enjoying health, medicine, and being an athlete. Seeing these injuries, being able to diagnose and fix them and get people back to where they want to be, it's just exciting. When an athlete is down, it affects them emotionally, psychologically, as well as physically. If you're the star of the team and you miss 6 months, it's a hard thing to go through. So I just enjoy being able to try to get people through that and get them back on track to where they belong.